India's daily COVID count is still moving steadily and strongly upwards. In the latest figures, India has crossed over 3,60,000 cases in the last 24 hours. The overall total deaths due to COVID-19 in India has crossed the 2 lakh mark. In the midst of this, the biggest question on everyone's mind is, when is this second wave, which is turning to be fairly deadly? When is it going to peak? When is it going to plateau? What are the reasons of this spike that seems to have caught everyone unaware, and which started in the beginning of April and a little before that in the last week of March? To speak on some of these aspects, I have with me one of the foremost epidemiologists in the country, Dr. Jayaprakash Mulian, who's also the chairman of the Scientific Advisory Committee of the National Institute of Epidemiology. Dr. Muliyil, thank you so much for speaking with us here at ET Now. Let me begin by getting your thoughts on the reasons and the patterns that this second wave is showing. By now, we've had some form of restrictions in most parts of the country, or at least in those parts where we have seen a large number of cases. Yet, the case count continues unabated. What is the reason for that in your view, sir?
You're asking for the reason for the surge, but more appropriate maybe to ask for the reason why cases came down so tantalizingly after September. It stayed on falling. What was the reason? The reason was the virus was not finding enough susceptibility. A good proportion of our well-to-do, educated, careful citizens practice caution. And I think for the virus, that was a difficult hurdle to cross, and it was coming down. And fortunately, we also came to a point where vaccine was becoming available. Unfortunately, some of the new variants that came out turned out to be a little more infectious, compounded by the fact a bit of confidence that nothing can go wrong crept into our collective mind. A little carelessness and a little more excitement in taking part in day-to-day affairs of the world. I mean, various kinds of activities blossom. I think that was irresistible for the new virus or the variants, and there we have a spike. This spike is just a reflection of the fact what the ICMR survey on November had told us, that overall the 25% of the population had been infected. That means a large chunk was still susceptible. However, our optimism wouldn't look at it. We thought we probably had gotten rid of the virus or getting rid of the virus. It came back because there was enough susceptibility. I think our behavior was a little overconfident, and there are reasons for it. But anyway, I think this is exactly what you expect in a person-to-person transmitted virus, respiratory virus especially. But one good thing you should remember, people who are previously infected are still safe from the new surge. And areas which were heavily infected in the earlier round are hardly having any viral activity. So I think you can trust your immunity acquired from the previous infection. So the same way it has come up, it will come down. And we have seen it happening earlier. Now that it infected a larger number, things look gloomy. But at the same time, always night is darker just before dawn.
You know, Dr. Muliyil, what about herd immunity and all of those who are propounding the theory of herd immunity? You yourself, sir, had spoken about herd immunity kicking in, I would say, October, November last year. when people felt it was going down and enough Indians had got the virus. Is the herd immunity theory effectively out of the window at this point?
Not at all. You take, for example, a place like Dharavi, which had about 60-odd%, 65% infected during the last round. During this epidemic, current time, there are no new cases there. So areas where came under very heavy infection, especially this urban slum area, are quite protected. What I started by saying was, we were seeing a fall in the cases earlier, even without reaching the required herd immunity of 50 plus zero positivity. And that fooled us. And for a little while we could have, excused, but it kept on falling for 5 months. And that, to a large extent, was due to the careful behavior of the people of India. But I think that sort of kind of vanished in between, and now we see this ugly face. So I'm going to say herd immunity is still going to kick in. And why do you think in Maharashtra cases are coming down? It will come down wherever it is. It will soon start coming down in Chennai. So this is the practice. This is what you expect in a viral epidemic.
Sir, let's talk a bit about, when we can see these cases coming down. You spoke about Maharashtra, which has been in relatively more stricter restrictions than other parts of the country from the middle of April. It was expected to last for 15 days. Possibly it might be extended as well. So we've already seen around 2 weeks of restrictions in Maharashtra, but if you see the numbers for the state as a whole, there has been no dramatic reduction, a bit perhaps in Mumbai. Is this showing a new kind of a response because of mutations? And secondly, by when do you think that this wave of the pandemic will peak?
The thing is, we look at a map and each state has a different wave. You look at the country as a whole, you seem to see a wave. Okay, now that is quite, confusing. Each locality go through a particular wave pattern. And if it comes down, and if there are enough susceptible, it will climb again. Now, when you look at India as a whole, it's quite confusing. It will come down in Maharashtra at the same time it will go up in, say, Assam. So that is kind of a picture that overall average is dangerous. The point is, a person already infected is not getting reinfected. I mean, if this is a virus that is completely a new mutant, and we call it, one of those immune escape mutants, then the same guys who got infected last time would get reinfected in large numbers. That scenario is not being enacted. So even now, those who get, for example, when you say 3.5 lakh cases have been reported per day, but the actual number is 30 times of that 3.5 lakh, almost 1 crore per day. New infections occur. So in a very short time, the total number infected and immune will rise, and that will bring down the epidemic. Now, I am not suggesting we go that far. We have to be careful, we have to reduce the exposure to the virus, and we should hope sincerely we have enough vaccine to push as fast as possible. Because even though the infection gives you immunity, it comes at a heavy price, mortality.
Professor Muliyil, You have mentioned now a couple of times that those who have been infected before are not getting infected again. But sir, the anecdotal evidence is quite to the contrary. There are a fair number of people who are getting reinfections, some of them even after taking one dose of the vaccine. Some people are being infected even after both jabs of the vaccine and a previous infection. So would you not take that into account?
Well, that is taken into account when I made the statement, because there are all kinds of possibilities. And in our science, we go by probability. If you have been infected once before, what is the probability you can get reinfected currently? And the chance is very low compared to a person who has not yet been infected. So, much bulk of the cases, now more than 95% of the people who are showing infection have not had exposure either to vaccine or to previous infection.
Okay. If you can take us through some projections, because right now people want to understand how far this is going to go and when is it going to get over. You mentioned earlier that the night is darkest before dawn. Are we in that space when we can start seeing the levels coming down, or is there more pain ahead? There are some projections that we will peak by the middle of May perhaps. What is your own view?
Well, difficult, and I will not dare to give one line number for India as a whole. The states which rise faster and higher will fall quicker and in a shorter duration. It's just a question of saturating the population with immunity. Preferably vaccine, if not, you'll get infection. But the arithmetic is same. Once infected, you will have quite a long-lasting immunity. Exceptions are there in all situations, and there are reasons for that, scientific reasons. But the rule is that this kind of this particular virus is a very immunogenic virus. It in fact induces production of about 22 different antibodies in your body. So that way, that's why vaccine companies were so optimistic about creating good vaccines. And in fact, most of the vaccines are quite good in terms of preventing serious outcomes. All I'm saying is that when you get into despair, the reaction cannot be do something. Ask the question, where is this going? The same old rules still hold good. If you wear a mask, you are protected to a great extent. Avoid crowds. Somehow we don't seem to follow those rules. Large chunks of population are not abiding by the simple rules. Don't want too many rules. Have just simple rules. Always wear a mask. Keep a distance from the neighbor. Then
okay, let me talk to you a bit about the vaccination program, Dr. Muliyil, because we are going to start phase 3 on the 1st of May. Today, the registrations are opening up and everyone above 18 can technically, legally get a vaccine now. The question is, where are the vaccines? Are you concerned about the vaccine supply pipeline for India and that whole pipeline being choked up and fewer vaccines being available, really delaying the eventual herd immunity that we hope to achieve?
correct. I agree with you. Am I concerned? Yes, I'm concerned. I'm quite distressed with that because I don't think we should have come to this state at all, because we were actually given emergency clearance at the time when it was given. I was quite unhappy because we didn't have evidence that the vaccine. Subsequently, in retrospect, I said, yeah, good thing it started because both the vaccines are quite effective. Now, we have this strange problem, we don't have vaccine. And that is uncomfortable. So, as long as this is a management problem. I don't know. There's nothing called a scientific conundrum. We have to sort it out, and I'm sure we'll be on track soon. But this delay is quite uncalled for.
What is the solution immediately, Dr. Muliyil? You have been a very strong advocate against lockdowns. What we are seeing this time around is not being called a lockdown, they're being called micro-containment zones, restrictions, weekend curfews, night curfews, essentially restrictions in different forms. Is that the only way to ensure that hospital infrastructure, medical infrastructure does not crumble, which it already is? Right now, is that the only immediate solution we have in hand till numbers come under control?
I suppose localized action based on the incompatibility between cases and facilities, the local people have to do something. But remember one thing, it is most important to continuously educate people. It's a pressure should come from among the within community itself. Law and order seldom works well. I mean, there's no point expecting people to wear masks just to please the policeman. It should come from within. And that we are good at communicating in many forms. So I think that is where we have to get back into making sure people do wear masks. And I think all leaders should wear masks continuously. I know I'm talking to you without a mask. Maybe I should also wear now. But I'm sitting at a home. But all the images should be mask-wearing people. And somehow that will become a habit. And I don't know what went wrong in between. We have seen scenes in the newspaper, in the media, that it has been given a complete go-by. And all we can do is to say, look at it aghast. I'm saying I am not against any restrictive behavior locally because sometimes you need it. You allow a wedding and then huge number gather there. And allow a function, things go wrong. That is not a disciplined way a population should behave. And I suppose in that context, some restrictions are allowed. But by and large, we have to worry about one more thing. I mean, the nation has to move on. And, random blockade, lockdown, though that is not quite helpful at all. In fact, it can be quite disruptive and harmful to people, especially those who are seeking health care. I think this time people have been careful, administrators have been careful to make sure that transport to important places, health facilities are guarded even during lockdown.
Yeah, it's not a heavy-handed quote-unquote lockdown this time round. There are restrictions though, and we'll probably see the impact of those on employment figures, on incomes over the next few quarters. Right now the focus is to save lives, as many as possible. Herd immunity via vaccine is the only way, via infections is the only way, says Professor Muliyil. He also says that where the cases have gone up sharply, there will be a decrease. It's only a matter of time. Thank you so much for speaking with us today, sir.